According to Dr. Nicholas Dixon, who specializes in applied ethics at Alma College, in assisted suicide, the final act is solely the patient's, and the risk of subtle coercion from doctors, family members, institutions, and other social forces is greatly reduced. Physician assisted suicide has always been looked down upon, been illegal, and been considered ethically wrong. However, over the years, many countries and 5 of our own states have changed the laws in favor of assisted suicide. Physician assisted suicide is when a terminally ill patient requests to end their life by having a physician either prescribe or administer a lethal dose of medication. Terminally ill patients are people who have exhausted all medical possibilities of becoming healthy again, who are clouded with many symptoms and more often than not a large amount of pain, and who only have a certain amount of time left in their lives. Today I will be informing you about physician-assisted suicide, and we will determine whether it should be seen as beneficial or as harmful. We will be examining that through 3 different points of view, being 1, the patients, 2, the doctors, and 3, the family members of the terminally ill. Many terminally ill patients are in favor of physician-assisted suicide. Most of them are in an immense amount of pain and do not want to spend the little amount of time they have left feeling that way. These individuals are not making this decision out of any type of mental health disorders. They do not want to commit suicide in a painful or degrading way, and they do not want to be seen as looking for an easy way out. In a famous case of physician-assisted suicide, we saw Brittany Maynard, a woman who moved to a different state in order to exercise her right to die after being diagnosed with a brain tumor. According to Nikki Egan, writer at People magazine who interviewed Brittany Maynard, already suffering agonizing headaches and terrifying seizures, she feared being in so much pain that no amount of morphine could help. She wanted peace. Another major reason why terminally ill patients support physician-assisted suicide is out of desire to die with dignity. Simply put, these human beings just want to have the right over their own bodies and to be able to choose how they want to die. Physician-assisted suicide is a very controversial issue for doctors. Dr. Jack Kevorkian, also known as Dr. Death, is one of the most famous people who have advocated for physician-assisted suicide. This is a photo of Dr. Jack Kevorkian, and this is what he called a death machine. He made this and then proceeded to use it in over 40 assisted suicides. Jennifer Lasson, writer at Time magazine, writes of Dr. Kevorkian, stating, "His sacrifice or his flagrancy, depending on who you ask, did succeed in bringing assisted suicide into the spotlight as he'd hoped." However, many doctors are completely against physician-assisted suicide. One of the major issues that doctors have with this is that they became doctors in order to save lives, not to end them. In a sense, physician-assisted suicide goes against almost everything that doctors believe in. And by participating in such an act, this could mean an end to doctors' medical licenses, their reputations, and their own personal beliefs. As physician-assisted suicide is discussed, the patients and the doctors involved are the main focus. However, the families of the terminally ill are the ones who are deeply impacted by the decisions made surrounding assisted suicide. The loss of a loved one under such circumstances could mean heightened emotional and psychological effects. However, there are many arguments that state the majorities of the families would be supportive of the decision. Watching a loved one suffer in pain and illness can be heartbreaking. Following Brittany Maynard's infamous death by physician suicide, Nicole Egan from People magazine interviewed her husband. In the interview, Brittany's husband, Dan Diaz, says, "Did I want her to die? Of course not. Did I want the whole thing to go away? Of course. But did I ever want her to change her mind? No. I would never want my wife to suffer for no reason." In the end, people only want what is emotionally and physically best for their loved ones. Today's speech was to determine whether physician-assisted suicide should be seen as harmful or as beneficial. Accepting and therefore legalizing physician-assisted suicide is the stance that we should take on this issue. By doing so, we provide the terminally ill the right to their own bodies and lives, the right to die with dignity, and the relief from the pain that they are suffering through. This is a major problem that the entire world is facing, and each country will have to take a stance on this. Although death is the endpoint, this option is more positive because it means less pain and suffering for both the terminally ill patient as well as the family members. This problem appeared to be solved at the beginning by being illegal. However, many advocacies for it began to cause changes in the laws, proving the initial stance was wrong. The action to take place now would be to legalize physician-assisted suicide for terminally ill patients. And to take the benefits even further, we should change it from terminally ill patients to also include people who have extremely poor quality of life. Every individual human being should have the right to die with dignity, as well as the right to die peacefully. Thank you.